Good evening, everyone. A very warm welcome to Liver Cancer Awareness Month, a nationwide public health campaign organized by Voice of Healthcare in collaboration with Isaiah Pharmaceuticals. I'm Dr. Muskan Ahlawat on behalf of Voice of Healthcare, and I will be coordinating today's discussion. It's an honor to have all of you here showing your interest in understanding and protecting one of the most vital organs in our body, the liver. Today, we are here to talk about a very important yet often overlooked health concern liver disease and liver cancer. The liver is one of the most vital organs of our body, silently working to filter toxins, aids digestion, and regulates many essential functions. Unfortunately, liver diseases are often detected very late as they progress quietly, earning the name silent threat. But the good news is that with timely awareness, healthy lifestyle choices, and medical intervention, recovery and improved quality of life are very much possible. Through this session, we aim to understand risk, awareness, and better pathways to live better liver health. So, in our session, let's welcome Dr. Charles Panackel, Senior Consultant, Hepatology and Liver Transplantation at Aster Medcity, Kerala. He will help us understand basis of liver cancer and debunk some common misconceptions and provide some practical guidance for our ongoing care. Thank you, sir, for joining us here.
Thank you, Dr. Muskan.
Sir, beginning with very basic and mindful question that we are discussing nowadays about liver health awareness. So, in your opinion, what exactly is liver cancer, and what are some clinical signs a person or an individual go through when he or she has liver cancer?
Yeah. When you talk about liver cancer, there are two types. One is the primary liver cancer, where the cancer it occurs primarily in the liver. The first time it comes in the liver, and second is a secondary liver cancers, where cancers that occur elsewhere in the body, like the lung or the kidneys or the intestines or stomach, they can spread to the liver. That's called the secondary liver cancer. And what we are dealing today is about the primary liver cancers, and the most common primary liver cancer is the hepatocellular carcinoma, where the liver cells develop into a cancer. So that's the most common primary liver cancer worldwide. About 90% of the primary liver cancers are hepatocellular carcinomas, and about 10% can be the other rare cancers like the cholangiocarcinomas or the hemangioendotheliomas or hemangioendotheliosarcomas. So today we'll be mainly dealing with hepatocellular carcinoma.
Correct.
And
Sir, you were saying
when you talk about hepatocellular carcinomas, it can normally it occurs in the background of a chronic liver disease like liver cirrhosis or chronic hepatitis B, that's a viral infection of the liver, or chronic hepatitis C, which is again another viral infection of the liver. And most of the time, the liver cancers are not symptomatic. Usually, they don't present with any symptoms. They are detected incidentally when you do ultrasound for some other reason, or when you do a blood test for some other reason. And when symptoms occur, it's often late. And symptoms can be in the form of pain in the abdomen, it can be in the form of abdominal discomfort, or it can be in the form of some forms of liver failure, like jaundice, that's a yellowishness of eyes, or you can have distension of the your tummy where fluid fills in your tummy, or you can vomit blood. So all these are complications of liver failure. And once symptoms occur, most of the time the liver cancer is in an advanced stage. So it is always better to detect liver cancers early by screening.
Thank you, sir, for explaining basis of liver cancer. You were mentioning about background of alcoholic person that it may develop into liver cancer. So my next question is related to that. That many of us assume that liver disease is only because of consumption of alcohol. So, sir, are there any other factors that also contribute to liver cancer or liver disease?
Yeah, it's often a myth that only alcohol causes liver disease. Uh, Nowadays, most common cause of liver disease in India and worldwide is what is called the non-alcoholic fatty liver disease, or the fatty liver that occurs in a non-alcoholic patient, a person who doesn't drink alcohol. And most of these are due to our lifestyle. It's a lifestyle disease. So it's commonly due to our obesity, that's excess weight, patients having diabetes, persons having excess cholesterol in the blood, persons with metabolic syndrome. So the most common cause for liver disease nowadays is not alcohol, but non-alcoholic fatty liver disease, what is now called the metabolic dysfunction associated liver disease. And alcohol comes as the second common cause after non-alcoholic fatty liver disease. And there are multitude of other causes like viral infections, hepatitis B or C, that can cause chronic liver disease and can lead to liver failure. Then there are some hereditary conditions like hemochromatosis, where excess iron gets accumulated in the liver, or Wilson's disease, where excess copper gets accumulated in the liver. These are inherited conditions that runs in the family. And females can have autoimmune liver disease, where your immunity it attacks the liver and damages the liver, leading to liver disease. So, female most common cause would be a non-alcoholic fatty liver disease or an autoimmune liver disease. And rarely some of the medications and drugs that we take, it may be any form of drugs, but if we take some of these drugs for long term, they can cause damage to the liver and can lead to cirrhosis. So alcohol forms only a part of the story. The most common would be your lifestyle disease called the non-alcoholic fatty liver disease.
Great. Thank you, sir, for explaining multiple causes from infections to lifestyle and genetics. So, sir, can lifestyle interventions like diet, exercise, or stress management reverse early stage liver disease?
Yeah, as I said, the most common cause for liver disease is a non-alcoholic fatty liver disease, and this is a lifestyle disorder. So that means it's due to our diet, the bad diet, and lack of exercise. And so by with the diet and exercise, you if you can reduce your weight, then that can reverse even early cirrhosis. So it's not only fatty liver, but it can even reverse fibrosis. If you have a third stage or fourth stage fibrosis, even that can be reversed with your diet, exercise, and weight loss. Along with that, you have to control your diabetes. Diabetes has to be tightly controlled. The cholesterol medications has to be taken to reduce the cholesterol. Your blood pressure has to be controlled, and you have to try and achieve a weight loss. Even if you don't achieve a weight loss with your diet and exercise, you can reverse steatosis and some to an extent even fibrosis.
Sure, sir. I think these practical tips would help us to be aware about liver diseases. So, sir, as a hepatologist, what would you suggest that what are the clinical signs or some clinical tests that indicate progression from liver disease to liver cancer?
So yeah, uh, we don't routinely recommend a screening in a population for liver disease, but persons who have got risk factors, persons who have obese, persons who has got diabetes, who has got dyslipidemias, or persons who had a previous jaundice or hepatitis B or C, or has got a family history of liver disease. So any person with the uh, risk factor is always better to screen them. And screening for liver disease, it starts with blood test. That is, you look at the platelets, you look at the liver function test, and liver function test includes the bilirubin that looks at the detoxification or the cleaning function of the liver. Then there are SGOT, SGPT, and alkaline phosphatase. These are enzymes that denote the damage to your extended damage to your liver cells. Then you have the albumin and the prothrombin tank. And these are the proteins that are synthesized by the liver, that is made by the liver. So by testing this, you can know the synthetic function or the productive capacity of the liver. So liver does multitude of functions, and all these tests has to be done to know whether the liver is functioning normally. Along with this, you need to do a ultrasound and a fibroscan of the liver. So the ultrasound tells you whether you have got a fatty liver, whether you have got a chronic liver disease or cirrhosis, whether any cancers in the liver, whether there's any complication that are developed in the liver. And the fibroscan gives you the stage of the liver fibrosis. So to say that a liver is normal, all this test has to be done, but we don't routinely recommend all these tests in a normal person. But any person who has got a risk factor for liver disease or a liver cancer, needs these tests.
Sir, is there any particular age for this test, or it generally depends on symptoms if a person is having some?
Yeah, there's no age for this to get a liver disease, but
Hmm.
if you have got a risk factor, because if it's a hereditary disease that can occur in younger age groups,
Any?
and
So,
yeah, so if you have got a risk factor like it's a family history of liver disease, then you start screening early. But if you are taking alcohol excess, or if you have got diabetes and you have got fatty liver, then the risk of liver disease occurs later in the life. So yeah, it can liver disease can occur at any age, but screening depends on the risk factors. If you've got hepatitis B, chronic hepatitis B, then we recommend screening irrespective of age with liver function test and ultrasound every 6 months. Same with cirrhosis. If you have got a cirrhosis or a chronic liver disease, then again you have to screen with the LFT, the alpha fetoprotein, which is a cancer marker, and ultrasound every 6 months. So the screening depends on the risk factor the patient has.
okay. Thank you, sir, for explaining about all the diagnostic facilities that are available. So, as we are moving ahead, we have talked about basis of liver cancer, some diagnosis. Can you throw some light on the treatment options that are available nowadays for liver cancer or any liver disease?
Yeah. First of all, let's start with liver disease. The mainstay of
Hmm.
treatment is lifestyle modification. So any form of liver disease, you need to stop alcohol. If you're taking, and you can't take even one glass of drink a day. Well, that's the commonest question that we get. Is there a safe drinking limit? There's no safe drinking limit that we should know. Second, lifestyle modification with diet, exercise, and weight loss. Irrespective of etiology for liver disease, you need to have a lifestyle intervention. Then, depending on the cause, if it's hepatitis B or C, then we have got potent antivirals that can cure hepatitis C and that can control hepatitis B. If it is hemochromatosis, that's excess iron, then you remove the iron from the body so that your liver recovers. If it's Wilson's disease, again, you remove the copper from the liver with the chelating agents, and then so that the liver recovers. The autoimmune liver disease that commonly occurs in females are treated with immunosuppressants like steroids. And one of the most important things that we should, as patients, should be aware of is that you should try and avoid all possible alternate medicines. So unless the drug is prescribed to you by a doctor who knows that you have got a liver disease, you should not be taking that. So you should always try and avoid drugs, because most of the drugs that are metabolized or removed by the from the body by the liver. And once you have a liver disease, any safe, even safer drugs will cause toxicity to your body. So always try to minimize drugs unless they are essential and prescribed by a doctor. So these are things that you should be looking for in any patient with a chronic liver disease. So when it comes to uh, cirrhosis, that's a late stage of chronic liver disease,
Hmm.
then you are trying to treat the complications. So cirrhosis can have various complications like you vomit blood, you get fluid in the tummy, you get jaundice. So then, depending on the complication that you get, you treat the complication. And when it comes to liver cancer, it's a primary. We'll be talking only about primary liver cancer. That's a
Hmm.
hepatocellular carcinoma. So there are various stages from 1 to 4. Stage 1, if you detect early, stage 1 and 2, it can be cured. That means either by a surgery you can remove the tumor, by a transplant you can remove the tumor with the liver and put in a new liver, or you single small tumors can be ablated. That's you burn the tumor either using a current, using a laser, using a microwave, or you you can burn it using what is called the transarterial chemoembolization, where you do angiogram, you identify the blood vessel, and you block the blood vessel to the tumor so that the tumor stops of its nutrients and oxygen. And if it goes to stage 3, then the treatment would be a radiation or a immunotherapy nowadays. And if it goes to stage 4, then most of the time, stage 4 patients will have advanced chronic liver disease, and many a time it's basically a palliative but supportive care.
Sir, as you were talking about treatment options, so if someone is going through treatment or they have, uh, they have completed their treatment, is reoccurrence of liver cancer common, and how follow-up care should be recommended to those patients?
So, when liver cancer, once you have a liver cancer, you need lifelong follow-up, irrespective of the treatment that you have received, even after transplant. So, all liver cancers are followed up lifelong after treatment. You do a CT scan and a tumor marker like alpha fetoprotein or a DCP. So, you do that every 3 months for the initial 2 years. And if there's no recurrence, it doesn't come again, then you increase the frequency to every 6 months for the next 5 years. So that's how we follow up our patients. So all patients who have a liver cancer, even if they had a curative treatment, there's a risk that it can come back because that liver is still there. The damaged liver is still there. So new cancers can come in the damaged liver, and hence you will have to follow up the patient for life.
Okay. Sir, you were mentioning that new cancer can come in the liver. If someone gets liver transplantation, so still they can get liver cancer?
Yeah, unfortunately, yes. Okay, that depends on the initial stage of the cancer. If there are various criteria that we use to select patients for transplant, so single tumor less than 5 centimeter, up to three tumors largest less than 3 centimeter, then the chance of it coming back is less than 10%. And these are the patients who will have the best result with the transplant. But mind you, even in these patients, if you do 10 people with this criteria, one can recur. And this recurrence occurs because at the time of doing the transplant, most of the time there might be small tumor cells that are in the blood, that are circulating in the blood, and these are not found in your routine scans. So there can be single tumor cells that are circulating, and after that, can your transplant. Normally, in a normal person, these tumor cells are cleared by your immunity. Your body's immunity takes care of infections. It prevents cancers from developing in the body. So after the transplant, what we are doing is that to prevent rejection, we are reducing the immunity of the patient, and these cancer cells can grow, and it can grow in the new liver or it can grow outside the new liver. So there's a 10% chance that even transplanted patients can get back the cancer.
Thank you, Dr. Charles, for explaining the treatment options that we have for liver cancer patients. Sir, my last question to you would be that what practical steps can patients or caregivers or family members can take up at home to support liver recovery and prevents disease progression?
Yeah, as I said, the most important would be lifestyle intervention. So
Yeah.
you stop alcohol, stop all alternate medicines and all unnecessary medication you have to stop, and all the supplements and everything has to be stopped. You follow the advice of the doctor, take medications as per the doctor. You follow the advice of doctor on screening and follow up. So you do regular blood tests, you do regular scans, and at times you might need a endoscopy, regular endoscopy to look for a risk of bleeding from the liver. Okay, and reduce your weight. If you have got hepatitis B or C, you treat that and have a good diet, normal diet, and you follow the whatever advice the your doctor has given. So with a regular diet, exercise, avoiding alcohol, avoiding alternate medications, with regular follow-up with the doctor, then you can prevent the progression of your liver disease.
Thank you, sir, for explaining how it is a teamwork that we that include patient as well as family and medical team as well. Sir, before we end our discussion, let's move into a quick myth versus fact segment, where we will address some of the most common misconceptions around liver health. Sir, some patients believe that liver disease cannot be traced, and there are like no clear signs or symptoms. to detect disease. So, is there any possible way to monitor it or any early detection process?
Yeah. So most of the time, the liver disease is asymptomatic, meaning they don't show any symptoms unless you develop a complication. But many a time, early symptoms can be mild swelling of the leg, discomfort in the upper abdomen, nausea, early morning nausea, mild abdominal distension. These are the earliest signs that you can occur. And most of the time, the later signs of the disease are when complications occur. Like you get yellowish signs called jaundice, then you can vomit blood or you can pass blood in the stools, or you can have altered memory and altered sensorium, what is called hepatic encephalopathy, or you can have fluid in the tummy called ascites. So all this, most of the time, all this occurs when there is a complication of liver disease. And many a time, liver disease is diagnosed when you screen, when you do a test, do a function test or an ultrasound for some other reason, and then you find that the ultrasound is deranged or liver function tests are deranged, then that's a time when most of us make a diagnosis of liver disease. So screening is advised in all the high-risk patients, like if you have a diabetic, long-standing obesity, long-standing alcohol intake, or a family history, or past history of chronic hepatitis B or C, then screening is advised to detect it early.
Thank you, sir, for that response. So, sir, next notion is that liver cancer is always fatal and it will occur uh, again and again, and it will lead to only, I would say, a fatal outcome. Is this true or is this a myth?
Again, that's a myth. That depends on the stage at which your hepatocellular carcinoma is diagnosed. If it is diagnosed at stage 1 or 2, as I said, less than 5 centimeter single tumor, or up to three tumors less than 3 centimeter, by one of the curative treatments, you can cure the hepatocellular carcinoma. And this is a cancer that has got almost 80% 5 years already detected very early. So unlike other cancers of the abdomen, liver cancer is detected in stage 1 or 2, then it can give 70 to 80% 5 years survival. So the early detection is a key here. And all patients with risk factors and all patients with chronic liver disease or chronic hepatitis B, then they should undergo regular screening so that any tumor can be picked up early and a curative treatment can be offered.
Thank you so much, Dr. Charles, for highlighting and clarifying these myths with proper medical facts. So, sir, as we conclude, any message of hope that you would like to give to patients or family who are suffering from liver cancer?
Yeah, see, you don't have to worry. You just need to follow up with your doctor and follow the advice of the doctor, because most of the time, these are curative, and even if it recurs, then again a curative treatment can be offered as long as your liver functions are maintained. So always avoid things that can deteriorate your liver function, like alcohol, drugs, alternative medicines, and always avoid that. And if you can maintain the liver function, then curative treatments can be offered to liver cancer even when they recur. So yeah, you don't have to worry about liver cancer. It's treatable cancer.
Thank you so much, Dr. Charles, for sharing your valuable insights today. I hope the audience will find it very useful and follow these lifestyle choices that you suggested. Thank you so much, sir.
Thank you, Dr. Muskan. Thank you for this.
Thank you so much, sir.